Oh, what a story. Producer Doug always tries to, what is it, tug at the heartstrings?
Heartstrings.
The back to school time, of course, stressful for both kids and parents, and that could mean big problem for your skin. Oh no, here now, Dr. Richard Chaffoo with some tips to keep that summer glow alive. Doctor, good morning.
Good morning, Raoul.
Acne, teenagers, that goes hand in hand. We know that.
Yes.
Have things changed in terms of what they can do to prevent that?
Well, there are some things that have changed. And you know, Raoul, between the ages of 11 and 30, about 3/4 of Americans have suffered from acne. That's about 17 million people in the United States.
11 and 30?
Yes, between 11 and 30, quite a range.
That's a big range.
That's a large range.
Because people think it goes away when you...
Yes, no, not necessarily,
Yeah.
unfortunately. So things that you can do to help your skin out are some sort of common sense things. You want to do things that are going to help your skin in terms of moisturizing agents. You want something that's going to help to gently cleanse your skin. And then the important thing to remember is also that stress is a very common factor related to the development or making acne worse. And the reason being is stress is related to hormones. Hormones and hereditary are the major factors that are associated with acne. You know, teenagers are under a lot of stress today, as we know. There's all that social media. We want to put our best face forward, and kids evaluate themselves and others by how they look. So this is a time when they get very stressful, and more stress causes more cortisol, causes more acne.
I'm glad you brought that up, the social media and the stress, because the mental health benefits of clear skin, that does really affect, especially now, all the kids with the social media and this and that.
Exactly.
If they can't put forth...
and shown that kids that actually, when their acne is better, their sense of self-worth and their sense of confidence improves.
Why does acne present itself differently in so many people? Because I'm glad you brought, there's hormones, you mentioned hereditary, there's cleanliness, everything plays a part, but for certain people it's different.
Exactly, and part of that is due to the fact that the skin is a very unique organ. As we've said before, that it's the largest organ of the body, and the glands that are associated with all the problems with acne get plugged at different levels. So if you have an early plugging, you might just get what we call whiteheads and blackheads. If it gets worse, then you can begin seeing papules, cysts that can get red, large areas. So really you want to begin your treatment very early on to prevent these worse outcomes or outbreaks of acne.
How early are we talking about? How can teenagers and even tweens, if you will,
so
11,
you're right.
12.
So 11 and 12, just when we're beginning to start seeing the changes of hormones, that's the time to begin a good skin regimen. Make it something simple
Start
that you can
early.
easily,
Make it part of your day-to-day routine.
Day-to-day routine, exactly.
When should parents think about perhaps taking their kids to a dermatologist? Perhaps you do the routine, but then maybe that's when you said, maybe the hormones and the hereditary part of it come into play.
Exactly.
And they play a bigger role than just cleaning your face every day.
Of course, the important thing is, teaching kids, you don't want to pick your face, but then obviously sunscreens are important. To get in to see your dermatologist if the acne doesn't seem to clear up, or certainly if it gets worse. If you have some early things like blackheads and whiteheads, some over-the-counter treatments may be very effective, but if it begins getting red or inflamed, or you get cysts, at that point you need to get in.
We have some products here.
We do.
Explain what you brought.
So the different products that we have available are essentially two main categories. One is the benzoyl peroxides, which tend to dry out the glands and dry the skin out. And then there are the salicylic acids, which are related to aspirin. These actually tend to be what we're called keratinolytic agents. So they remove those outer layers of the skin, the dead layers of the skin, allowing the glands and the pores to secrete the oils and get them out from underneath the skin. Retin-A's are other great products. As we said, sunscreens are all important. So it's a simple regimen, but you've got to be patient. The skin takes about 28 days to turn over. So it's not a light switch. People think, well, I can start something now in 2 or 3 days. It can be clear. Literally, it can take a few months, so you have to be patient.
In terms of diet, is that a myth, or is it, because some people, you don't eat chocolate, and sometimes milk.
That's a great point. I asked my wife, who's a dermatologist, Dr. Stewart, and I said, well, what about chocolate and acne? She said, no, the problem is, Raoul, that when we get stressed, what do? We eat. We eat the wrong things. And so it's the stress that's responsible for increasing cortisol and making these sebaceous, these oil glands larger and plugging them more. So when we reduce the stress, we're going to help with the acne.
Sure. So at a certain point, you can go see the doctor. Any questions, just go see your doctor, your dermatologist, and they'll refer you if you have any further questions, right? That's the best advice we can give. Good stuff. And happy back to school for your children as well.
You too, right?
A little relief for parents at home. Thanks, Doc. Appreciate it.